Hi, everybody, and thanks so much for joining us today at EPI's briefing on sort of the economics of the COVID crisis and beyond. We thought we had all of this Zoom stuff completely licked. Apparently, we still have a small bit of the learning curve left to do. And so it was supposed to be Thea Lee giving this introduction, and she will talk to you in a little bit, but for now, I'm going to make some sort of quick introductory remarks, give an overview of where I think we are sort of in the economy right now, in the economic situation because of the coronavirus shock. And then if Thea comes in before too long, I will interrupt that to let her give some welcoming. Otherwise, we're going to sort of give you the presentations we were planning on, which is going to be me on sort of the state of the economy and what that means broadly for the policy agenda. Valerie Wilson, our director of the program on race, ethnicity, and the economy, or PRE, is going to talk about what we know about the disproportionate impacts of the coronavirus shock. Naomi Walker, who's the director of our state level network, the EARN network, is going to talk about sort of the state and local challenge that this shock has given us. And then Heidi Scherholtz, director of federal policy, will talk about strengths and weaknesses about what has been done so far. Lots of activity has happened so far, and yet she's going to tell about the many things that still need to be done to ensure that this shock leaves as little damage on sort of human welfare as possible going forward. And then I'm hoping we can talk about in the discussion and Q&A what this shock should tell us about what we want the American economy and policy regime to look like going forward. This is a huge defining event for a country, and the idea that we think we should go back to the exact same economy we had before, I think is probably a thought we shouldn't have.
Good afternoon, everybody, and thank you, Josh, for pinching in. It is wonderful to be here with all of you, and we so much appreciate everybody joining us. So we have a great program for you. We have our all-star lineup from the Economic Policy Institute, as Josh has introduced everybody. But I also wanted to just thank all of you as vital friends and supporters of EPI. We could not possibly do the kind of work that we do without your support. And today we're going to give you a quick recap of our take on the economic crisis. Josh has told you a little bit about it, but our economists and analysts have been churning out an extraordinary body of work, both in quantity and in quality, and have really helped to shape both the policy response and the media narrative. But without further ado, you will have an opportunity to ask questions through the Q&A feature at the bottom of your screen. We will first have all four of our speakers give short presentations, and then we will take as many questions. I will direct as many questions as we have time for to each of the speakers. You may also use the raise hand feature at the bottom of your screen if you want to make a comment. If we have time, we would love to hear from all of you. But without further ado, let me ask Josh Bivens to give us the big picture overview. Thank you so much, Josh, and thanks to all of you for being here today.
Oh, hello again, everybody. I'm Josh Bivens. I'm the research director here at the Economic Policy Institute, and like Thea said, I'm just going to try to give a big overview of where we are in the economy now, what is the size of the coronavirus shock, and a little bit of a sort of timeline of the work we've done on it. And so I would say I'm pretty sure that our last day actually in the office at EPI was around March 13th. And for a couple of weeks before that, in the office, we were working really hard to try to get policymakers to understand the severity of the shock that was coming their way. And so we've been worried for a while about what's happening, and what were treated as sort of alarmist forecasts from us by policymakers in early March, now we would welcome them with open arms. And so, for example, if you look, deep enough, that is like just early last month on our website, we looked at some forecasts from Goldman Sachs about what the coronavirus was going to do to the economy. And we said there could be 3 million jobs lost by the summer. And we were, pushed back hard by policymakers on the Hill that seems really alarmist to us. We think you're just, being a little Chicken Little here. Now, there's not a person in the world who wouldn't think 3 million jobs is the total number of jobs lost. That would be a dream. We would love if that was. Instead, it's likely to be in the realm of about 30 million jobs that will be lost by summertime. So I think we've been ahead of this curve. Well, we've been behind it, but we have been far ahead of others in recognizing the severity of what was coming our way. And a real challenge has been the speed of the shock coming our way. It's really hard to measure. Like for those of you who are, slightly in sort of the nerdy world of actually knowing what Jobs Day means, the first Friday of every month, the Bureau of Labor Statistics releases an estimate of the unemployment rate as well as the number of jobs gained or lost in the last month. We really haven't had a Jobs Day that has even captured, say, 70% of a full shock. We had a Jobs Day that measured the month of March, but that survey really happens on March 12th. And by March 12th, the full shock had nowhere near manifested itself. One thing that's interesting is even that March Jobs Day was kind of disastrous. I think it was about 700,000 jobs were lost. That was among the worst months we had during the Great Recession and the financial crisis of 2008 to 9. And yet we all know by March 12th, there was still a huge wave yet to hit the US economy. We really think on May 8th, when the data for the month of April comes out, we're going to be looking at seriously like 25 million-ish jobs lost in a single month in the US economy. Over the entire peak to trough of the Great Recession, the financial crisis of 2008 and 9, that job loss number would have been less than 9 million cumulative over the entire sort of 18 months. And so the size and the speed of this shock is just sort of breathtaking. So we've scrambled really hard trying to exploit kind of the dribs and drabs of data that have come out so far. We've even collected our own data, and we've tried to use the sort of highly uncertain forecasts for what's coming our way to try to get people to understand how big the shock coming our way is. The one bit of real official data that we've been able to monitor is new unemployment insurance claims. And so if you look over the past 5 weeks, there have been 24.4 million new unemployment insurance claims. We're going to get a new tranche of numbers tomorrow. I think our best guess is between another 3 to 4 million claims will likely be filed. And then we've heard the stories, the way you probably have as well, is about UI offices just being completely overwhelmed. So people try to call, they get a busy signal. They try to go to the website, it crashes. They line up physically outside the office, and the line's too long and they run out of paper. And so a couple of our economists, Ben Zipper and Elise Gould, actually fielded their own Google survey where they asked people, have you tried to apply for unemployment insurance in the past 4 weeks? And what they found was for every 10 workers who successfully filed a new unemployment insurance claim over the past 4 weeks, there were probably 3 to 4 workers who were frustrated in their attempts to do so. And so probably even that 24 million new unemployment insurance claims are probably understating the amount of people who've been laid off over that time by about 30%. And we released that, gosh, I think it was just yesterday. And it got the attention it deserved, which is it deserved a ton of attention and it got a ton of attention. And I think it really woke up people to two things. One, as bad as we think things might be, when the real data comes out and we get to measure it with some precision, it might actually be worse. And in the sort of more narrow but incredibly important issue of just how prepared are we generally in the unemployment insurance system specifically for the shock that's come our way, it's not very prepared. And I think that should be a big theme. When we get through the immediate crisis policy response, we really need to enter the next crisis with a social insurance system that has not been disinvested in for decades and which is actually ready to respond with some flexibility and speed and administrative competence to another big shock coming our way. I hope we get through my lifetime without a shock like this ever happening again, but it would be kind of silly to just hope for that rather than prepare for that. I would say just to get people up to speed on where sort of the current uncertain as they are, forecasts are for how big the shock is. We got a number for first quarter gross domestic product growth today. And so basically, again, if you think the real bulk of the shock happened about mid-March going forward, you would have thought that's not going to infect the first quarter gross domestic product number all that much. It's only half of 1 month, and there are 3 months in that first quarter. And yet GDP contracted by about 5%, which would have been a pretty impressively bad number even in the Great Recession of 2008 to 9. But it was only a half a month effect, give or take. And so we know the second quarter GDP number is going to be pretty spectacularly bad. Goldman Sachs is still standing firm on a estimate that GDP will contract at a 35% annualized rate in the second quarter of this year. Again, to compare to the single worst quarter in the Great Recession, their contraction was less than 9%. So about 4 to 5 times as large as the worst 3-month period we saw during the last recession, which, you know, everyone at the time said was the absolute worst thing we'd seen since the Great Depression. We've gone far beyond that universe of sort of badness, steepness of contraction. I think the real open question, so everyone agrees that April, May, June will just show a staggering sudden stop of economic activity. And then the real question becomes, you know, will we bounce back quickly from this or not? And so some of that is sort of out of our remit as economists. Lots of that's a public health question. Will the virus actually, will we see cases decline enough that people feel safe to actually, you know, start a phased return to normality? We don't know. What we do know is that once there is something like a public health all clear, or at least now's the time to start a phased return to sort of economic normality, how quickly a bounce back happens will be entirely conditioned by policy. It'll be conditioned by how ambitious we are in providing the relief and recovery that's needed. So over a couple month period, we want to give people income even when they're not working. We actually don't want a return to employment. We want people to be able to stay away from public places where they might spread the disease, and yet we want people's incomes to be sustained. And so the more generous we are with that relief, you know, the less households will emerge from this having blown through savings or taken on huge debt, and the more poised they're going to be to unleash pent-up demand once the public health all clear actually sounds and we can begin that phased return to normality. And then once there is that sort of closer to normal sort of sense of economic activity, we want to do a lot of spending to make sure that producers feel like there's a lot of demand out there for what we're selling, and we want to hire as many people as possible and get payrolls back up to speed. And I think we're going to have to realize that that's going to be pretty slow for a lot of sectors. They're just, you know, to be really concrete, it's going to be a while before I think people gather together to watch a sporting event. And that's not a small number of jobs that are associated with that. That's going to take a long time coming back. And so we should think about where we want other activity to rise up and take its place. And it's just obvious as day, there's lots of places for that to happen in a productive way, whether it's public health interventions like contact tracers, hiring people to monitor the virus going forward. Like the idea that this is just going to be done in June and we can never worry about it and never have to worry about it again, I think that's wrong. I think there's going to be a lot of ways to spend money that will be incredibly productive ways to spend money to make sure we're monitoring this, we're doing the public health things that need to happen, we're providing the equipment that needs to be done to hospitals. And so I think a much bigger footprint for the public sector for, I mean, at least the next year as a response to this is going to be a big part of an operable response. And then finally, I'll just end with, I think going forward, this has been a huge defining event, and we should think hard about why the economy was so vulnerable to a shock like this, and why we're doing such a bad job relative to, say, lots of our international peers in shielding people and households from the misery of this shock. And I think a huge part of that vulnerability stems from having such weak social insurance systems and public investments over recent decades. And we really should think about how we reverse that in coming times. And so from here, I'm going to stop with that overall picture, and I'm going to turn it over to Valerie Wilson, who is the director of our pre-program, who's going to talk about what we think about, you know, the pain and its distribution and its very uneven distribution that we've seen. Valerie?
Thanks, Josh. And good afternoon to everyone on the call. It's really been a resounding theme of this crisis is that we're all in this together. And while it's true, we know that everyone in this country and probably around the world has been affected in some way, as things continue to develop, it becomes increasingly clear, and we recognize more and more that the magnitude and the nature of the way in which people are being affected is anything but universal. So EPI has highlighted some of the particular vulnerabilities, both health-wise and economically, experienced by 3 groups of workers, one being older workers, women, and people of color. So I'm going to talk a bit about each of those groups and some of the findings and things that we have highlighted based on our work. starting with older workers. So I think that we all know and have heard that older workers face more serious health risks related to COVID-19. The CDC estimates that about 8 out of 10 deaths from COVID-19 have been in adults age 65 and older. But older workers also face significant economic risks related to the pandemic. On that point, we know that 4 in 10 workers who are age 50 or older lack paid leave. So the opportunity to stay away from work to protect your health while still being able to support yourself and your family is a challenge for that group in particular. We've also found in some work that my colleague Elise Gould and Monique Morrissey have done, older workers are among the least likely to be able to work from home. Another solution that we've all resorted to in these times is telework. But about 2/3 of those between the ages of 55 and 64 cannot telework. And that represents about 15 million workers. When we look at some of the things that have been done to sort of lessen the economic impact of the crisis on different workers, things like expanding eligibility and benefits for unemployed workers, we know that that has definitely helped many older workers who've lost jobs, including a large number who work for small businesses or were self-employed. But those relief measures generally have not covered or applied to older workers who leave or have to quit a job because their age puts them at increased risk. And then finally, what we just know historically is that older workers who lose their jobs in a recession take much longer to find work once the economy is in a recovery. And as a result of that, they suffer large pay cuts when they are reemployed, or they often opt to retire earlier than planned, which throws any previous retirement planning sort of out of whack in terms of the resources that will be available to them in retirement. The second group that we have highlighted in terms of vulnerabilities is women. When the crisis struck, it was just probably a week or two before Equal Pay Day in early April. I believe it was at the end of March this year, actually, March 31st. And so we took that opportunity to look at the virus through the lens of this issue of unequal pay or gender pay disparities. And 1/3 of working women, compared to just about half that percentage, 15.7% of working men, about 1/3 of working women are employed in the 2 industries that have been most significantly impacted by the coronavirus, but in very different ways. Those 2 industries are the healthcare and social assistance industry, which of course is experiencing surging demand as more people are seeking care. But at the other end of that spectrum is the leisure and hospitality industry, which has been crushed by closures and layoffs as well. And women employed in both of those industries face a gender wage gap across all different occupations. That applies to women who are surgeons and physicians, nurses, and on the other end of that, in leisure and hospitality, we see that among wait staff, as well as among hotel desk clerks and those who work in the hotel industry. So even though we've seen the impact hit differently in different industries, across those industries, an underlying weakness of our economy that has been exacerbated by this crisis is the gender pay gap. Additionally, sort of building on some of what Josh was saying about the impact on job loss, the latest payroll employment data that we have for March showed that women actually were the hardest hit by the initial job loss in the COVID-19 labor market. Women represented 50% of payroll employment in February, but represented almost 60% of the job losses in March. We don't take that to necessarily be a clear indication that moving forward, we will continue to have these, largely disparate impacts by gender. We will see what happens when the new numbers come out, but it is important to know that at least that initial loss has hit women at a much higher rate. And then finally, the third group that we have been focusing on and will continue to focus on are people of color. And again, I think if anyone has been awake in the last month or so, you've heard the stories, you've seen on the news. Black and Latino workers face much more health insecurity from COVID-19 than white workers, but also much more economic insecurity. And there's this sort of interesting duality that we see in terms of the economic impact, because on one hand, we find that Black and Latino workers are more likely to be employed or have been employed in sectors that lost a lot of jobs, and so are facing economic insecurity for that reason. But on the other hand, those workers are also disproportionately represented among these essential jobs, lower wage jobs, where they may have greater job security, but face greater health insecurity and greater risk in terms of bringing the virus to their homes with their family members and others that they're caring for in their communities. We know that deaths disproportionately have been at higher rates among Black and Latino workers, and the range of that disparity we've seen vary across different geographic regions and in different cities around the country. But we see a similar dynamic with workers of color that we see with older workers when it comes to the ability to telework. So less than 1 in 5 Black workers and about 1 in 6 Hispanic workers are able to telework during the crisis. The way that I think about the disparate racial impact and sort of summarize or wrap all of that up is that when it comes to the disparate racial impacts of coronavirus, we really aren't dealing with a new problem, but we're dealing with an old problem in a new context. And the reason that I say that is because many of the persistent disparities that we've seen for years in health status, access to care, wealth, employment, wages, income, poverty, we can just go down the list. Those longstanding and persistent disparities are really behind the trends that we're seeing now in terms of the disproportionate health and economic security visited upon communities of color. And so one of the things that we are working on moving forward is pulling together a lot of the work that we've done here over the years in highlighting those economic disparities and connecting that with the data that we have and are gathering on the health disparities, as well as some other areas that are relevant to the way that solutions are being crafted to this, in particular looking at disparities in banking relationships. Again, this week we've seen stories about low-wage workers, low-income households who are being delayed in getting their checks from the government, either because they don't have a bank relationship, the way that they filed their taxes was through a third party, and so there's been some mix-ups with that. And then finally, another issue that has arisen as it relates to racial disparities has to do with the Small Business Administration program and whether or not minority-owned businesses have had equal access to those funds and those resources for staying in business and keeping their employees on staff. So I will stop with that and turn it over now to Naomi to talk about some of the things that we have observed at the state level.
Great, thanks so much, Valerie. First, I want to talk a little bit about some of the work that the EARN Network has done, and then talk a little bit about some of the state state challenges states and localities are facing. EARN is a network of 55 groups around across 43 states in the District of Columbia that really form the progressive policy, research, and advocacy infrastructure that's really focused on lifting up workers' voices with state policymakers and local policymakers. And, you know, it's very clear, you know, the crisis that we're facing now has really magnified the flaws and fractures in our state and local infrastructure, as well as the national infrastructure that's really supposed to be there to help support folks. And there are a host of policy options that states could have had in place that really would have helped cushion workers and communities from the economic crash resulting from the pandemic. But because states have been so slow to enact programs like work sharing, which would have let employers reduce hours while still keeping people attached to their jobs and allowing them to collect unemployment insurance to help make up the gap for those reduced hours, programs like paid family leave, paid sick days, and much stronger state unemployment systems that had a federal floor, not a ceiling. If we'd had all of those programs in place in the states, it really would have helped cushion some of the economic impact. And so one of the things that we've been doing with the network is really hosting a series of weekly webinars and strategic conversations with hundreds of EARN groups, grassroots partners, other state and national policy and advocacy allies to talk both about what states should be doing to respond to the crisis and what the federal government should be doing to help states and localities in this moment. And so we've covered everything from unemployment insurance, worker safety and health, paid leave, the impact of folks on of the pandemic on folks who are incarcerated, and several other topics. And actually this afternoon, we're hosting a discussion with several current and former state labor enforcement officials to talk about what labor enforcement agencies can and should be doing to protect workers during the crisis. One of the things that our team does each week is to produce state-by-state unemployment numbers. They're also breaking down the health insurance data that Josh and his team have produced about the number of workers who are losing health insurance in this moment. They're able to break that down by state. And those two products really help inform EARN Group's economic analysis of what's happening in their states. We've also been trying to take not just a state focus, but also a regional focus. There have been some interesting interstate compacts being formed within across several of the states, particularly in the Northeast and in the West. And a lot of our work is being organized along regional lines too. We've done a host of blog posts and papers about the impact by region and the policy solutions that are needed in the South and Midwest. You know, Valerie talked about the disparate impact the pandemic and economic crisis has had on women and people of color. And around the country, EARN groups, particularly in the states that are opening prematurely, Ohio, West Virginia, Georgia, and others, are issuing a series of reports really taking a look at the industries and occupations that are most impacted by these premature reopenings and digging into what the demographics of those workers and those industries look like. And of course, you won't be surprised to hear that women and people of color are really most impacted and most at risk as states open up without any empirical reason to do so. But what I want to spend a little bit of time talking about is the need for state and local aid. I think it's one of the most important things that we can do to make sure that workers and their families are protected. We believe that states, localities, territories, tribal governments have to have $500 billion in direct unrestricted aid before the end of 2021. You know, unlike the federal government, state governments, almost every state government, I think Vermont is the only one that isn't required by law to balance their budgets. And as economic activity has collapsed, so too is state and territorial and local revenues, just as they face huge new spending demands as a result of the coronavirus. And so already states and localities are announcing austerity measures and severe budget shortfalls right when public spending is most critical, both for protecting workers and for priming the economy for a bounce back. So, you know, in states like California, California is projected to spend down its really sizable cash reserves in just a few months. Nevada is expecting a budget shortfall of almost $700 million over the next 2 years. Local governments are announcing severe revenue shortfalls as well. New Orleans, Seattle are both projecting shortfalls of at least $100 million just this year. And so while we believe that state and local governments should pursue progressive revenue solutions, we also know that they are much more likely to slash state and local budgets. But we also know that state and local governments can't cut their way out of this fiscal crisis. The crisis is just too severe, and the budget cuts will further depress demand in the economy and have a really devastating effect on public services and programs, everything from education to healthcare to public safety. You know, as we saw with the Great Recession, it takes years and years for these programs to rebound once they're cut at the state and local levels. You know, in many states, education spending didn't rebound till pre-recession levels, even 10 years after the Great Recession. And, you know, the impact on workers is similar. You know, 10 years after the start of the Great Recession, both Black and Asian households had not recovered their pre-recession median income. So the more we can do now to stave off these cuts, the better. The other thing I just want to mention about one of the impacts of the Great Recession is in the elections that followed the Great Recession, the 2010 elections and the 2011 state legislative sessions, a lot of the particularly conservative or right-wing gubernatorial candidates really used the economic anxiety and budget gaps that were stoked by the Great Recession to campaign on and then pass a whole host of anti-worker and anti-union attacks, from the emergency financial management law and right to work in Michigan, right to work in Indiana, AB 10 in Wisconsin, which undermined and destroyed really public sector collective bargaining rights, and SB 5, which was in Ohio, which was another attack on bargaining rights. It was ultimately overturned by voters, and the right wing has already signaled the attacks on pensions of public sector, public service workers. So the budget picture at the state and local levels have really important impacts, not just for all of us who depend on these services and the workers who deliver them, but also you know, the institutions that allow workers to have a voice on the job. So within the EARN network, we are just got off a call actually with the EARN leaders from around the country, and we are really working hard to identify and pursue the state policy solutions that will help people cope with this moment and get back on their feet economically. But we also want to use this as an opportunity to really pursue state and local policies that help create a reimagined economy that works for all of us. So with that, I am going to turn it over to Heidi Shearholtz, our Director of Policy and Senior Economist.
Everyone does states. All right. Thank you, Naomi. Thank you, everyone. I am just happy to be able to share this information today and have this nice discussion. Josh, Valerie, and Naomi laid out really well the need for additional substantial, sustained federal relief. And what I think the key thing is, that what policymakers do right now will absolutely determine how much pain working families experience and how fast the economy gets back on track when the lockdown is over. And the Congress has passed three and a half, they call it, three and an interim bill relief and recovery packages so far to the tune of almost $3 trillion. But even at that level, they are not big enough to deal with the scale of this crisis. And while they did include some very good provisions, they also included some big policy missteps and omissions. So more relief and recovery is absolutely crucial. And I'm going to go over some, there's a ton to talk about. There's a ton of stuff here. So I'm going to just hit highlights. But we can definitely talk about this more in the Q&A if there's pieces of this that I miss that you're interested in, or I'm happy to talk offline. I think all of us on this webinar so far have talked about the importance of more aid to states and localities, and I'm gonna say it again because it really is, I believe, the top priority right now. One of the reasons that aid is so important is that most of the state aid that has been made available so far in the relief and recovery packages can only be used to cover costs directly related to the virus. And that money is important because states are at the front line of this. They are incurring huge new costs to contain and treat the virus and respond to the spike in joblessness. But at the same time, as Naomi said, they're projecting sharply lower tax revenues because of the collapse of economic activity. And that means if states and localities don't get more unrestricted aid, they'll have no choice but to respond by laying off state and local employees, teachers, everyone, cutting back government contracts for businesses, cutting public services, etc. And those actions will make the recession worse, and they will make the recovery slower. And I think some recent CBO economic projections underscore just how big of a deal this is. So CBO last week released some economic projections, employment, GDP. They project that without further intervention, so if Congress does nothing, the unemployment rate will average 10.1% for the entire calendar year of 2021. So just for comparison, the highest the unemployment rate ever got in the Great Recession was 10% and was only 10% for 1 month. So one of the things that we are talking about is that federal policymakers must provide at least $500 billion in relief to states and localities to help fill these massive budget shortfalls they're facing. We also need additional investments in unemployment insurance. The relief packages that have already passed have been pretty good on this. They included $250 billion in expanding unemployment insurance. That included an increase in the level of benefits people get. That's that $600 top up that essentially everyone who receives benefits will get. And also the creation of this pandemic unemployment assistance program that was modeled off of disaster unemployment assistance programs that typically go into effect when a hurricane hits or something. It'll be a localized program, but now we're having this disaster across the whole country. So this pandemic unemployment assistance is available to all over the nation. And the key thing about that is it's going to be available to many workers who are not eligible for regular unemployment insurance, like gig workers, independent contractors. They're not eligible for regular unemployment, but they will be eligible for pandemic unemployment assistance. It's taken a while to get up and running. Even now, it's not up and running in every state, but workers are starting to be able to access that pandemic unemployment assistance. So it's taken too long, but it's getting up and going now. But another thing I just want to say is they did leave out a couple of really key groups that are worth, like the next package should expand to include them. Undocumented immigrants. We have 8 million undocumented immigrants in this country. Leaving them out of this kind of assistance is an absolute humanitarian disaster, but it's also a public health disaster, because if you don't give those workers relief if they lose their jobs, if they're working and they get sick, they're going to have zero incentive to actually self-quarantine. They're going to know that that job is the only thing that's standing between them and economic devastation. So they're going to be going to work, and that's going to exacerbate the pandemic. So it's a terrible policy on a couple of levels to not include undocumented immigrants. And then another group that's excluded that should be included are new entrants. to the labor market, like students graduating this spring who they didn't technically lose a job, right? So they wouldn't be eligible for regular UI, but they're clearly out of work as a result of the virus. They would be getting, leaving school, getting jobs this spring if the virus weren't happening. So they should also be eligible for unemployment insurance. We just need to expand the program. Another crucial thing that none of the temporary provisions to boost unemployment compensation should be allowed to expire at an arbitrary date. That's how it currently is set up, and it doesn't make any sense. There's just huge uncertainty around how the next weeks and months will unfold in all this. So arbitrary end dates make zero sense. We should include triggers that allow these programs to phase out only as economic conditions warrant. So current projections, and this is going back to the CBO projections I already mentioned, those projections sort of underscore how strange it is to have these arbitrary cutoff dates. The unemployment rate is likely to be over 15% when the additional $600 per week in unemployment insurance benefits is currently set to expire at the end of July. And the unemployment rate is likely to be over 10% when the expanded eligibility, that PUA system I described, when that sunsets, currently scheduled to sunset at the end of this year. These provisions just cannot be allowed to fully expire until actual economic benchmarks. And one we've been talking about is the employment to population ratio for workers aged 25 to 54, until those kinds of benchmarks are restored to just reasonable levels. All right. We should also absolutely include strong mandatory safety protections for all workers performing essential work during this crisis, as well as strong protections ensuring that workers can speak up without fear of retaliation if their employer is not providing the required safety equipment. So there we need to make sure workers have safety equipment. Lawmakers should also now act to establish safe alternative voting methods, like vote by mail. We also must make significant investments in testing and contact tracing, because I'm not an epidemiologist, but I'm going to go there for a second. Absent a vaccine or effective treatment for this virus, there is no way we'll be able to open the economy successfully without an effective system of testing and contact tracing in place. I was on a briefing yesterday with House members where there were two of us on the panel, an epidemiologist covering the science of this, and I was the economist covering the economics. The epidemiologist, who was fantastic, noted that with on the order of 200,000 contact tracers, we could have an effective program of tracing in place. We could easily do this. We hire 500,000 temporary workers every 10 years to conduct a decennial census. We could do a large-scale hiring of public workers for contact tracing, and that's one investment that would help not just in controlling the virus and making it possible for us to be able to reopen the economy earlier, but would of course also help the workers who would get those jobs and their families, and therefore help the broader economy and speed the recovery. So those are just highlights of the things that we are priorities for the next recovery package. We have a blog post that covered a bunch of this that I'll put in the chat, but also I'm absolutely happy to talk about any of this, but I will now turn things over to Thea, who I think is going to moderate the Q&A.
Well, thank you so much, Josh, Valerie, Naomi, and Heidi, for amazing presentations. I know that's a lot of material there. And let me just let people know that the session is being recorded, so you can go back and re-listen to it if you want to. But also, you can find a lot of resources on EPI's website, www.epi.org. Each of the folks there have written up much of the arguments that they've been talking about. So let's get to a couple of questions. And just to remind folks, if you want to put something into the Q&A box, you can do that. And we had a couple of questions that came in ahead of time that people sent to the moderator. And I'm going to start with Josh with two questions. One that's in the Q&A box about, are there models other than the Goldman Sachs model? And I know Heidi mentioned the CBO model. What are the most accurate, reliable job forecasting models? But the other question is a bigger one. This is the big framing question, which is people are starting to say we can't afford the big kinds of programs that you all are talking about here, the big expensive programs that we have to worry about the deficit, we have to worry about mortgaging our children's future and so on. Josh, what's the best response to the concerns that people raise about the deficit?
I mean, I think there's a couple of responses. I mean, one is just at the broad level. I mean, the question of how much debt is almost always the wrong question. The question is it being used to buy something smart or dumb? And so for a household, someone who takes on debt to go gamble at the racetrack is being dumb. Someone who takes on debt to get a credential that's going to let them earn more throughout their lifetime is being smart, even if we'd rather they didn't have to take on debt for that education. For the public sector, it's the same thing. I think taking on debt 2 years ago to give corporations $1.5 trillion in tax cuts was dumb. Taking on debt to provide unemployment insurance and genuine relief to people in the face of this crisis, and to make public investments that will help both in the immediate health response, but also make us less vulnerable to future shocks, that is just smart. And then to get to the slightly more sort of wonky technical side of this, taking on additions to deficits and debt only hurt if they start pushing up interest rates or inflation. I mean, that is the classic textbook story about when you should be worried about deficits and debt. When they push up interest rates and you start crowding out productive private investment, that's when you think to yourself, have I started to take on too much debt? That is obviously not happening right now. We have seen interest rates and inflation just collapse because the economy has been hit by what is going to basically in the end look like a mammoth negative shock to demand. And so what we're going to see is if we do enough stimulus and enough recovery, we're going to be able to do public investments. We're going to be able to keep people employed. We're actually going to boost private investment because people are actually going to have to add to capacity because there'll be customers coming in the door rather than customers, fleeing and staying at home. And we're not going to see that sort of crowding out of productive investment. If we start to see a spike in interest rates and inflation, we should think about paying for this relief with some taxes. And we've got plenty of room to tax people, especially at the high end. But for now, there's just zero evidence that the increments to debt and deficits are hurting us.
Thank you. Thank you so much, Josh. Great answer. For Valerie, Edward Lorenz from Nice, France writes in, he wrote in ahead of time, will COVID-19 reinforce in the longer term the earnings gap between those who are able to telework and those who are limited to on-site work? And I know you raised some of the issues and the research that we've already done, but what's your view, Valerie, in terms of how this is going to play out in the longer term?
So I think as we have always seen, disparities, racial disparities, gender disparities don't resolve themselves. Unless we do something intentional, unless we are focused on those disparities and have specific steps to address them, then yes, they will continue. And based on what we've seen so far in terms of the impact by race and gender, at this point, I'm sure that there is a growing wage gap and income gap based on who you are, where you live, what job you had before, et cetera. And so, yeah, the short answer is that I fully expect that we will continue to see racial disparities and gender disparities in income and other economic measures unless we are intentional in addressing those. Some of the conversations that I've been having with other folks who are concerned about economic and racial justice issues is, this is a moment and an opportunity for us to think about how we rebuild in a better way. That we don't necessarily want to get back to normal, because normal included a lot of inequality, a lot of disparities. We want to get to a point that we are better than normal and addressing a lot of those persistent inequities.
Thank you very much, Valerie. And for Heidi, Anton Hajar writes in, the National Labor Relations Act provides strong protections for workers, both union and non-union workers, who refuse to work in unsafe conditions. Has the word gotten out to workers, and do you think there will be job actions by the meat packer workers in response to the Trump executive order requiring them to reopen? And if it does happen, do you think the NLRB will go ahead and enforce the law effectively?
Those are really good questions. I think sometimes we do tend to think the NLRA provides more protections than it actually does. I think that there's a lot of loopholes there. But if workers, and then we have this problem right now with the NLRB we have right now. If workers take act, like this NLRB, the Trump NLRB, is not going to step in and protect workers. So I do think it's a very tricky situation. I've been involved in a bunch of correspondence with DOL just on how, like, this is not happening just in meat packing, but in all of these states that are opening up, and workers who are now, they lost their jobs, they're getting unemployment insurance, but if they get called back to your frontline, you know, say you're whatever, work in a clothing store in Georgia and your employer reopens and calls you back, many workers very legitimately could feel like that is not a safe workplace, that's not a suitable job, but they will likely either have to take that job, the first order effect there is that they would, because they got offered that job, they would no longer be eligible for unemployment insurance benefits. So there's been, like, they could still get unemployment insurance benefits if they have, say, a kid whose school closed that they have to take care of, but that would be then they would sort of jump over into, I'm getting unemployment insurance for a different reason aside from the fact that my employer is closed because of COVID, because they're no longer closed because of COVID. But if you just feel like your workplace is not safe, and you actually, I mean, is it an extremely legitimate concern right now? There's a lot of questions, and I think the first order interpretation is that you likely will not be able to get unemployment insurance benefits, but there's a lot of conversations going on to try to clarify what that's about. But these early openings really put workers and their families in a terrible situation.
Thank you, Heidi. And we're almost out of time, but maybe a quick question for Naomi. Mark McDermott was asking about the post office, and I know that's something that you've thought a little bit about. I know it's not exactly in the state. Oh, the post office. We talked about a lot of the other different policy levers that are important right now, and we all know that the post office is under attack and is facing a lot of severe economic consequences. What are the consequences both for the country, really, of letting the post office go bankrupt, which is what the administration is doing right now? And does that have an impact also as we talk about the need to move to more vote by mail going forward?
Yeah, and I'll actually call on my colleagues in the Josh and maybe Valerie, who've done some work with the postal workers unions. But yeah, I think the post office is a critical piece of our national infrastructure, and to allow it to go bankrupt is a huge mistake. You know, a lot of the Republicans think that everything should be allowed to go bankrupt, the states, et cetera, like let them go bankrupt and it'll all work itself out, which is a horribly misguided policy. You know, the other piece about the post office is the huge equity impacts that, like, letting that institution go down would have, given the large numbers of women and people of color that are employed by the Postal Service, have made it into the middle class because of good postal jobs. And I think this is something that as progressives, we've really gotta fight to protect. But I open it up for Josh and Valerie to chime in.
I mean, I'll say something just quick and super big picture speculative on this as well. Like, so the post office, besides just providing, you know, really vital public services, and the fact that it sort of gets graded against a private sector profit-making institution makes no sense at all, both based on what Congress has made it do to evaluate its retirement obligations, but also just the fact that it has to do unprofitable things because it's a public service. It is not a profit-making. I would say if we wanted to go the opposite direction and actually expand the importance and the role of the post office, you could imagine lots of people have talked about postal banking for a long time. Post offices are spread out. They could provide low-cost payment services, checking accounts to people. And if we had a postal banking system in place when this crisis hit, we could have gotten the stimulus checks to people much quicker. We wouldn't have to mail them out. Everyone would have an account. The money could have just appeared there. And to get even more big picture, if you have a postal banking system, you could actually have the Federal Reserve put money in people's accounts directly without having to wait on Congress. Now, the Federal Reserve might not even want that power right now, since that is a big expansion of their remit. But they have, over the past 15 years, they have moved faster than Congress in responding to recessions in the better way. And so I say giving them a tool that could actually get money directly to people should be the kind of big thing we have in mind as we emerge from this crisis.
All right, I know we're pretty much out of time, so I'm going to wrap it up right there. But thank you so much to all of our speakers, to Josh and Naomi and Valerie and Heidi for sharing with us some of their thoughts. And for all of us, I think the last point that Josh made is really important and that has been raised throughout, which is what are we learning from the crisis, from what's gone wrong, from the failure of our social safety net, from the underfunded and outdated technology of our delivery systems for the unemployment insurance system. Such an important system. It's important not just in the middle of a pandemic crisis, but it's important all year round, every year, and yet we have allowed these systems to be understaffed, underfunded, and for their technology to be so far out of date that we are limited in the kinds of solutions we can offer to folks. But I think all of the points that Naomi made in terms of what we see happening at the state, and I think that actually responds to one of the issues that was raised in the Q&A also, which is if the federal government doesn't do what's needed, what other steps can we take? And I think, you know, we do have the state and local governments, and we see a lot of activism, and we see a lot of state and local governments stepping up to the plate and filling in the gaps. We need, going forward, of course, we need to use what we've learned from the crisis to inform what kind of a federal government we need, what kind of state and local governments we need, what kind of revenue and spending systems and public health systems going forward will help us be more efficient, more resilient, and more fair going forward. So let me thank all of our speakers and thank all of you for joining us this afternoon. I hope you'll check out some more resources on our website at epi.org, and I hope you will stay in touch going forward. Thank you again for joining us, and have a great afternoon.